Doctors, what was the worst thing you've seen for a patient that another doctor overlooked? I'm not a doctor, but I'm an ER nurse, and this story still keeps me up at night. A guy named Kevin came in around 11 p.m. on a Tuesday. He was maybe 42, wearing this old Seahawks jersey and looked like he hadn't slept in days. He kept saying his back was killing him and he couldn't get comfortable no matter what position he tried. Dr. Williams barely looked up from his clipboard when Kevin described the pain. He did this super quick exam, maybe 2 minutes tops, and said it was just muscle strain from lifting something heavy. Kevin mentioned he worked construction, so Williams just nodded like that explained everything. He wrote a prescription for some basic painkillers and told Kevin to go home and rest. But something felt off to me. Kevin's face was this weird pale color, almost gray, and his breathing seemed shallow. I've seen enough people come through these doors to know when something's not right. When I checked his blood pressure, it had dropped from 140/90 when he first came in to 110/70 about an hour later. That's not normal, especially for someone just sitting around waiting. I walked over to Dr. Williams and pointed out the blood pressure drop. He barely glanced at the chart and said Kevin was probably just anxious about being in the hospital. He actually rolled his eyes at me and said some people just get worked up over nothing. I wanted to argue, but he was already walking away to the next patient. Kevin was getting ready to leave, and his wife Emma was helping him put his jacket on. I couldn't shake this feeling in my gut. I walked over to another nurse, Janet, who's been doing this for like 20 years. I showed her Kevin's vitals and asked what she thought. She frowned and said his heart rate looked irregular too, something we hadn't even mentioned to Dr. Williams. Janet and I went back to Kevin and told him we wanted to check his vitals one more time before he left. His heart rate was all over the place, and his breathing was definitely more labored than when he first came in. Emma looked scared and asked if something was wrong. I told her honestly that I wasn't sure, but maybe they should ask for a second opinion. Dr. Williams got pissed when Emma requested another doctor. He said he'd been practicing medicine for 15 years and knew muscle strain when he saw it. But Emma stood her ground and said she wanted someone else to look at her husband. She could tell something wasn't right either. Dr. Martinez came over and actually listened to what Kevin was saying about his pain. Kevin described it as this tearing sensation that started in his back but was moving toward his stomach. Dr. Martinez's expression changed immediately. He ordered a CT scan right away, and within 10 minutes, the results came back. Kevin had a rupturing abdominal aortic aneurysm. Basically, a major blood vessel near his spine was tearing apart. If he had gone home like Dr. Williams wanted, he would have bled out internally within an hour, maybe less. The whole ER turned into chaos. Kevin was rushed into emergency surgery, and I stayed 2 hours past my shift to make sure he made it through okay. Emma was crying in the waiting room, thanking me over and over for not letting them leave. She said she knew something was wrong but didn't know how to argue with a doctor. Dr. Williams tried to act like he was part of the team that saved Kevin's life. He kept talking about how they caught it just in time, using we like he had anything to do with it. But Emma made sure everyone knew I was the one who pushed for the second opinion. She even wrote a letter to the hospital board specifically mentioning how I refused to give up when the first doctor dismissed her husband. 3 weeks later, I got a handwritten thank you card from Kevin with a picture of him and Emma at their daughter's college graduation. He wrote that he almost missed walking her down the aisle because of his back pain, but now he'd be there for her wedding too. The hospital gave me some quiet recognition, but honestly, seeing Kevin alive and healthy was enough for me.